You are listening to the AI World Podcast, your trusted source for the latest innovations, insights, and trends in artificial intelligence, blockchain, fintech, and decentralized technologies. Each episode features expert interviews, engaging discussions, and in-depth analysis of how AI transforms industries worldwide. Stay ahead of the curve with the latest articles and exclusive reports from the AI World Journal, covering everything from emerging technologies to industry breakthroughs. For more news, global events, and access to AI World Society circle gatherings, visit us at aiworld.tv. Don't forget to subscribe to stay informed, stay connected, and be part of the AI revolution with AI World Lounge. Thank you for listening.
Welcome back to The Deep Dive. Today, our mission is really to look at the future of healthcare. But not the glossy concepts way down the line. We're talking about technology that's already moving into practice. Right now, at the bedside, we're focusing on a specific AI platform called OpenEvidence. We've got sources detailing how it works, its frankly unbelievable adoption rate, and maybe the most compelling part, a first-hand account of a clinician using it in a busy hospital. It seems like a complete rethink of how quickly evidence-based knowledge gets applied.
It really is. And if we just start by framing the sheer scale of the problem this tech is tackling, it makes what they've done even more remarkable. I mean, medicine generates millions, maybe hundreds of millions of pages of new research every single year. No person could possibly keep up. So the core question for you listening is this. How can an AI possibly bridge that huge knowledge gap? We're talking, 35 million peer-reviewed papers,
Right.
And connect that to a single critical decision the doctor or nurse needs to make, like right now, in seconds.
That's exactly the friction point, isn't it? The bottleneck AI is designed to just obliterate. And the best way to really grasp this isn't some technical paper, it's a human story. Our source material kicks off with someone's personal experience. They were in the hospital for minor surgery, and they're just resting, observing their registered nurse, Kathenne. She's using an app on her device. It was clearly functional, but what really stood out was how seamless it felt, like it wasn't an interruption. The immediate feeling described was that Kathenne had this super smart, knowledgeable assistant right by her side, just there, quietly helping out.
And where that assistant is located,
Okay.
that's the crucial point. Yeah, for too long, AI in medicine meant these big, expensive systems locked away in labs, running models, crunching billing data. This story confirms this shift. OpenEvidence is right there on the front line. It lets a nurse say, double-check a tricky post-op protocol or a drug interaction without leaving the room, without breaking that flow of care or having to go hunt down a thick binder.
That seamless integration sounds absolutely key. It's not some clunky add-on. It fits the workflow.
Okay, so let's properly introduce the platform itself. OpenEvidence. It's an AI-powered medical tool specifically designed for healthcare professionals and, importantly, restricted to them. That focus shapes everything about it, I imagine.
Oh, absolutely. And its origins give it serious credibility. Launched in 2021 by Harvard-trained AI scientists Daniel Nadler and Zachary Ziegler. But the real confidence booster, its validation. It went through the Mayo Clinic Platform Accelerant Program. See, with clinical decision support, you can't just trust a black box. That rigorous testing ensures the core content is high quality, clinically sound. That's non-negotiable.
And that pedigree seems to have led to just explosive adoption, which, knowing healthcare tech, is...
Well, it's astonishing.
Staggering is the word, yeah. OpenEvidence is used daily by over 40% of U.S. physicians. Just pause on that. Nearly half the doctors in the country. Across over 10,000 medical centers, using it every day. To get that kind of uptake in just 3 years, it speaks volumes. It tells you it works, it's reliable, and it solves that knowledge problem instantly. Those numbers just wouldn't exist otherwise.
That's a massive endorsement from the actual users. You can't argue with that. But connecting that huge scale to security, that's vital with patient care. How do they keep it trustworthy at that level?
Well, reliability is nothing without rock-solid security and controlled access, right? So there's a crucial non-negotiable security step. Users have to authenticate their medical credentials. You prove you're a licensed professional. This isn't like asking a general chatbot for advice. It keeps these powerful clinical tools strictly in the hands of people qualified to use them. It's a critical barrier for safety and for legal reasons, too.
And that barrier connects to the quality of information they're actually accessing. The sources say OpenEvidence uses only top-tier peer-reviewed knowledge bases like New England Journal, GMA.
Exactly. It's pulling from the gold standard. So the AI is synthesizing the best available medical knowledge, which creates a totally different risk situation than, say, using a general AI. Because the system is grounded only in these vetted sources, it massively cuts the risk of spitting out wrong or hallucinated information. That kind of error is just completely unacceptable in a hospital setting, obviously.
Okay, let's get into the mechanics then. Because trust matters, but only if the tool is actually usable when you need it. Speed seems like the currency here. So how does OpenEvidence deliver that certainty in, like, the 5 critical seconds a clinician has?
It's that blend of speed and depth. The system gives you fully cited answers. It shows its work, basically in a crazy fast 5 to 10 seconds. That instant synthesis just removes the mental friction. The doctor or nurse doesn't have to pause, break concentration, tell the patient, hang on while I look this up. The answer is just there, almost immediately.
And the engine behind that speed is the sheer volume of data. Over 35 million peer-reviewed publications. You said earlier no human could keep up. That number definitely proves it. The AI isn't just finding documents, it's synthesizing the latest best practices from all that.
Precisely. It's not just a search engine.
Yeah.
Now, let's make this concrete. Let's look at those 4 specific ways Nurse Kathenne was seen using the tool. These examples really show the immediate practical value.
Okay, first use. Quickly accessing best practices and guidelines for post-surgical care. Why is that one so critical?
Well, post-surgical guidelines change. They can be complex, patient-specific. Without instant access, a nurse might just rely on memory, maybe older protocols. OpenEvidence ensures every decision, when to get the patient moving, wound care details aligns with the absolute latest evidence. It helps standardize that high-quality care, makes it achievable, consistently.
Right. Second use. Summarizing complex research studies into concise, actionable insights, that sounds like a huge time saver.
Oh, massive. Imagine a patient has another condition, a comorbidity, right? The nurse needs to quickly understand a new study's implications for that patient before adjusting the plan. Reading and digesting even one complex study could easily take an hour, maybe more. OpenEvidence gives the key takeaway, professionally vetted, instantly, so the nurse can integrate that new knowledge on the spot.
Okay, the third use feels really significant for safety. Double-checking medications and procedures, like a digital safety net.
This is where it really acts like a co-pilot, yeah. Medication errors, dosage, timing, interactions. They're still a major issue in hospitals everywhere. Having an AI that can instantly check a drug against the patient's full profile and the latest studies, that's a powerful check. It's an immediate, high-reliability confirmation for high-stakes decisions. It adds a layer of safety every single time.
Makes sense. And the last one observed. Refining clinical notes for accuracy and completeness. That sounds more administrative.
It is, but it's critical admin. Good, precise notes are essential for continuity of care between shifts, for billing, for legal records. The AI helps polish the language, make sure all the key details are captured efficiently, so it streamlines things, meaning less time charting, more time actually with the patient.
And beyond these day-to-day uses, there's also a feature for the really tough questions, this deep consult service. How does that work for more complex cases?
Right. Deep consult is for when you need, well, a deep dive, a really rare condition, maybe conflicting studies on a treatment. The clinician uses Deep Consult, and it synthesizes multiple relevant studies, not just summarizing one, but comparing evidence, arguments across different research papers. It produces a comprehensive research brief. It basically turns hours, maybe days of manual database digging by a specialist into an instant query. Supports that top-level expert decision-making.
Wow, that really does sound like having an expert research team on call 24/7. But let's shift back to the human side. Because with all this AI power, it's still an assistant, right? Not the one in charge. What does all this efficiency actually mean for the patient?
Yeah, that's the core question. The so what for the patient is fundamentally better human care. The sources are really clear on this. AI handles the intense research load, the heavy lifting, but the clinicians, they still use their professional judgment. They make the final calls. The AI provides input, a consult. It's not giving orders. The human expertise, the empathy, communication, that's still firmly in the driver's seat.
And that efficiency boost translates directly into better interactions. You mentioned Nurse Kathenne. The source said having instant info meant more time for her, more time explaining things clearly to the patient, checking comfort, answering questions properly. The AI removed that need to mentally switch gears and go research something, letting her stay focused, stay present.
Exactly. It changes the role. The nurse or doctor isn't acting like a human search engine anymore. They're a clinical expert, supported by the fastest research assistant ever created. And the partnership works because it's transparent, the system cites its sources, and because access is tightly controlled, that builds trust. It makes the AI a genuinely reliable partner at the bedside.
So the clear takeaway for you listening seems to be AI isn't here to replace the vital, compassionate work of healthcare pros. It's revolutionizing that work, streamlining things, cutting down errors, helping deliver safer, more personalized care. The source material nails the future, I think, not human versus AI, but humans supported by AI as a trusted assistant. Okay, let's quickly recap the key things from this deep dive on OpenEvidence. We saw that incredible adoption, 40% of U.S. doctors using it daily. That really prints value. We hit on the crucial security piece, only credentialed professionals get access. That's fundamental for trust. And we detailed the real-world safety benefits, like instantly double-checking meds, drawing on those 35 million studies in critical moments.
Yeah, it feels like a pivotal moment. AI is leaving that future tech category and becoming a standard tool right now. The evidence shows it can bridge that gap between overwhelming research and immediate clinical practice. But here's the final thought we want to leave you with, something to chew on. If practical AI like OpenEvidence can instantly lift the massive research burden in medicine, connecting 35 million studies to a bedside decision in seconds, what other field, what area of human expertise that's currently drowning in specialized fragmented knowledge will be next? What field will be transformed when its experts get this kind of practical, verifiable digital partner?
A question that definitely goes way beyond the hospital walls. Thanks for diving deep with us.
The future of artificial intelligence is unfolding, and it's happening at AI World Week, the flagship global event for innovation, collaboration, and transformation. This flagship global AI event is designed to connect visionary leaders, trailblazing entrepreneurs, and influential thinkers to explore the endless possibilities of AI. Experience groundbreaking technology that redefines industries and inspires progress. Join thought-provoking discussions on ethical AI, digital equity, and the transformative role of technology in our world. Build meaningful connections that catalyze innovation and drive impact. AI World Week is powered by AI World Society, a global movement dedicated to advancing AI responsibly and ensuring it serves humanity. Together, we're shaping a smarter, more inclusive, and equitable future. Continue your journey beyond the event with the AI World Journal, offering expert insights, in-depth analysis, and the latest trends shaping the AI landscape. This is your opportunity to lead, to innovate, and to transform the world with AI. AI World Week. We invite you to join us and embrace the AI revolution.